Welcome to the self-evaluation episode of the ASCO University Weekly Podcast. My name is Suresh Ramalingam, and I'm Professor of Hematology and Medical Oncology at Emory University and the Deputy Director of the Winship Cancer Institute of Emory University. Today, we feature a self-evaluation question on clinical research methodology, specifically informed consent process. We begin by reading the question stem. A 72-year-old man from Vietnam with extensive stage small cell lung cancer is interested in participating in a trial for second-line treatment. He does not speak English, but comes with a friend who speaks English fluently and Vietnamese moderately well. There is no consent form available in Vietnamese, and as there are only 4 more slots available on the trial, you do not expect additional Vietnamese patients to enroll. How should care for this patient proceed? Choices. A. An IRB-approved short form in Vietnamese should be used that describes what the patient can expect to be told about the study. B. The patient should not be consented for the study due to time constraints for translation and disease status. C. The patient's friend should take the form home, have it read in Vietnamese by a family member fluent in both languages, and sign. D. The patient's brother, who is fluent in both languages, should serve as translator and witness using the English consent form. E. The document should be translated into Vietnamese and the patient should return to consent when available. The correct answer to this question is A. If less than 3 patients who speak a given language are expected to be accrued to a study, no fully translated consent form is necessary for the trial. The consent process must be performed similarly to that process of English speakers, that is, in person. The patient should still be considered for the trial, and translators should not be related to the patient to ensure a lack of possible coercion. A short form translation should be obtained and IRB approved. Option B is incorrect since it will exclude the opportunity for the patient to participate in the study. Option C does not provide the ability to verify if the patient completely understood the consent since the information was provided without the medical team's presence and is subject to incorrect information. Option D is incorrect since any bias on the part of the brother could lead to incorrect information delivered to the patient. Option E would require translation of the consent into Vietnamese, which might turn out to be time-consuming and might discourage the investigator from offering the study to patients that cannot speak English. Thank you for listening to this week's episode of ASCO University Weekly Podcast. For more information on clinical research methodology, including opportunities for self-evaluation and board review, visit the Comprehensive e-Learning Center at university.asco.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.